drugs remain the main problem for law enforcement, and they deal with it on a daily basis. That's why they're looking for all the help they can get.
Well, help is here, at least in New York County. The National Guard is teaming up with the Kennebunk Police Department in a special pilot program to help with the drug problem in the state. Joining us this morning is the Chief of Police of Kennebunk, Bob McKenzie, and Sergeant Rick Frost with the National Guard. Thanks for coming on, guys.
Thanks for having us.
Pleasure.
First of all, Chief, you see it firsthand out on the streets. What are things out there on the streets when it comes to drug? I mean, you said this is the #1 problem.
It certainly is. It affects us at so many different levels, you know, with crime, society in general. So we need to have more efforts. We've been hyper-focused right now because of the opioid epidemic and wanting to save lives. We're trying to be very active in that, but we certainly need to look upstream and figure out how we can prevent. So I'm very excited about this initiative.
Tell us more about how this initiative came about, how this idea came about, and why it's so important.
Certainly.
Sure. Yeah, definitely. So I actually sat in on a webinar that the state was hosting a while back, and I had just come into the Maine National Guard working with the counter drug program. We do prevention work with communities. Sat through the webinar and saw Bob McKenzie sitting there with their drug czar, Gordon Smith, talking prevention. And that's kind of one of the areas that we want to focus on. We do supply reduction work as well with law enforcement. Wanted to do some prevention work, saw him, and he was definitely speaking my language. And I called him up right away and said, we gotta meet.
Chief, this is kind of like somebody riding in on a white horse for you, right?
Oh, absolutely. I'm so excited. I've been wanting to do something with prevention. We used to do much more years ago. I've been in the business 37 years, and we used to do a lot in our community around prevention. But again, it kind of took a back seat when the opioid crisis came to be because we were losing people, you know, so many people so quickly. So that's where we've been focused. So this was a breath of fresh air to come in. The timing was great, so very exciting.
And what's sort of the plan? How's it going to work?
Yeah, so basically what we're going to do is work together. This is kind of a pilot project that we have going on right in the Kennebunks area there. And the hope here is that we can get a lot of different sector representatives from the community to come in and help out. It's all volunteer, but we're looking for people from all across the community: health sector, education, law enforcement, business, parents, youth. All of these people in a room working together. I've got this laundry list of processes that I use to help do, we call it strategic planning. Call it 30,000-foot level planning that we do in an effort to maybe land the plane occasionally and do some ground level prevention work.
And you want to make this a statewide effort, not just York County and Kennebunk, right?
Absolutely, absolutely. I've been doing this work for a little while, and usually there are other sectors of a community that lead these local grassroots coalitions. This is the first time that I've worked with a law enforcement community that leads that sector, and this is the guy. For sure. Like I said, he was speaking the language from the very, very beginning, so I'm pretty excited. It's been going pretty well so far.
Are there misconceptions out there, you know, with the public as far as how big of a problem this really is, or this isn't in my community, you know, and just the fact that, you know, addiction knows no, you know, race or status or anything like that?
Absolutely. You know, we've done a lot of education over the past few years since the opioid epidemic had begun. And we've made a lot of progress, but there is still, you know, there's still pockets out there that don't feel it's a problem. Now, early on, there was a lot of media coverage. You'd hear almost every day with how many overdose deaths there would be. You don't hear that much anymore, but the problem is still down. Our deaths are down compared to the previous year, but we can't take our foot off the gas whatsoever. People are still dying. One death is too many. So this is an opportunity for us to get it back out there in the public and raise awareness and do a lot of prevention work with our youth.
You are so passionate about this, but this is really, it has become personal for you.
Very much so. So I've always had an interest around substance use disorder, even as a patrol officer. And but as time went on, I have 5 kids between my wife and I, and 3 of the 5 have been affected by substance use disorder in a very severe way. We're fortunate that we have all 3 with us, and all 3 are in recovery now. But it's a very tough and difficult road. I do speak about it because it just shows that it can happen to anyone. Our kids were probably predisposed because there is addiction in our family. So this just is more passion for me to do more, and hopefully this I know it will. This initiative will help other parents from having to go through what my wife and I have gone through.
We're so happy that your children are here and that they are in recovery. What does it mean for you to kind of hear that? And obviously it must reinforce, you know, why you're here doing this work.
For sure, yeah. It's just like he said, at this time, while the overdose deaths are down, the focus kind of came off a little bit. But this is like a fantastic opportunity for us to slow down a bit, and it gives us a chance to kind of look upstream, as he mentioned, and take a look at some of those root causes that put people in the stream in the first place. That's where the prevention work really comes into play, is that we're trying to prevent that first use, you know, raise that average age of onset, which is very, very young. In New England, it frequently hovers around 11 to 13 years old, which is very young for first use.
And that's why you guys do Red Ribbon. We can talk about that. And we have video of one of that when you guys use a Black Hawk helicopter. But so important to get the word out to kids when they're young. You mentioned that.
Absolutely, yeah. This is the time where the messaging can be as easy as you want it to be, but it resonates with the kids. It really, really does resonate. It comes at an opportune time when they're in that, you know, 5th grade. You know, age group where you can, you know, provide that message, and it really sinks in with them. You know what I mean? It really sinks in with them. So, yeah.
What has the response been from the community? Are you trying to kind of spread the word, you know, to you businesses and just residents and stuff like that? What are people saying to you about it?
So we're on the initial stages of this, and we are looking to build this collaboration. So we're at the point right now where we are reaching out to those different sectors within our community to engage with them and see, you know, get the interest there, so they come on board with us. We have sent press releases out in the community, and thus far it's been very positive. So.
Well, what's positive too for community members down there? This is you're not raising taxes to pay for this.
Absolutely. I mean, this is free for us, and resources are hard to come by. And what an incredible resource we have with the Maine Army National Guard. So I'm so happy.
And where can people learn more about the initiative?
Certainly. Well, they can always call us at Kennebunk PD or reach out to us via our website and request more information.
Awesome.
Yeah, you guys, thanks for spending time today to come with us, and very important topic to talk about.
Yeah.
Yes, thank you
Well,
again.
keep us posted on the initiative, and if we start expanding this across the state.
Certainly, we'll
Yeah,
be
it'd
back.
be nice to get it statewide,
Yes.
huh?
For sure.
Well, after